The 1980s were a time of crisis for the hemophilia community. The blood supply patients depended on for their clotting factor became contaminated, making them sitting ducks for HIV and hepatitis C.
There has been so much anguish and sadness in our community back in the day. I've been to a lot of my fallen brother's funerals and hospital beds because of the contaminated factor that went out in the 80s.
In 1984 is when approximately 70% of all hemophilia patients in the United States got HIV because it came through their factor replacement, which was blood-derived. 1984 was a long time ago. It was a tremendous epidemic, a total catastrophe for the community.
Our wonderful last generation of hemophilia patients was devastated by HIV, and we never want that to happen again. So we try as hard as possible to assure that the factor is absolutely pure and that there's not going to be any infection.
A large percentage of the hemophilia medications right now aren't dependent on the blood supply because they're synthesized.
The new recombinant genetically engineered clotting factor does not contain any human blood and doesn't transmit any of these viruses.
There has been no transmission to anyone with hemophilia from factor products since 1985. A similar story happened with hepatitis C. In the 1980s, 95% of the 18,000 people with hemophilia in the United States contracted hepatitis C, transmitted by the blood-derived factor that they were infused with. Since 1989, there has been zero transmission of hepatitis C by any of the plasma-derived factors.
The National Hemophilia Foundation works diligently not only to protect our own population, but the larger population of all Americans who use the blood supply. We're the ones that are the canaries in the coal mine who look out for everyone's well-being related to the blood supply.